Hello, this is video 3 out of the series of videos I'm going to do about living with and fighting cancer. So in the last video I covered my experience with pancreatitis and how that almost killed me, and I've never ever experienced anything more intense than that particular illness, for the reasons that I explained in the second video. So in this particular video, I'm going to cover the July-August period, and there are a lot of illnesses that got me during this period, and for me to mention them all is probably not possible because of the length of video that I'm making. I'm going to highlight or talk about the more serious and the unfortunately more memorable illnesses that I got over this period. So don't know the exact dates in July and August, but thereabouts. So in July, yet again, didn't feel great, and didn't know what was going on. Eventually I sort of established that this feels like what happened when I had pneumonia. So we go back to the hospital. They do their series of tests, as usual, basic x-rays, blood test, etc. It was established pretty quick that I had pneumonia again. So they give me a hospital room, they attach me to the drip and give me the antibiotics again. While I was in hospital with pneumonia, a couple things. The first thing is I experienced and I don't know for whatever reason, and the doctors don't know either, I experienced what they called was a minor stroke on my right side. I lost the feeling of my limbs on the right side. Now, fortunately, this was temporary, but at the time, I thought this was going to be permanent as soon as I heard minor stroke. But as I said, it was temporary, lasted a day or two and went away. So when I was about to get released on the last day, which was either the 4th or 5th day in hospital, the doctors said that we've detected, and these are the words they used, a white mass on your chest. We need to do further tests, further scans. Now, I didn't know what a white mass was, what the medical definition for that was. I discovered afterwards, of course, possibly cancerous. So I had to do CT scan and some other tests, and what they said was that this white mass was metastasizing, which I found out afterwards was spreading, basically. That's what they meant. And one of the doctors I saw, or oncologist I saw in the Philippines, said, look, we're not sure when this began, but based on what we understand so far, that this is metastasizing at double the rate it should. So it looks very aggressive. Now, unknown to what was going on, what to do, there wasn't really a lot of quality advice coming back with next steps. So I got released, made an appointment to see this doctor again in a week or so, to work out next steps, I guess. So during that period of waiting to see what happens next, etc., I was brushing my teeth in the bathroom, and I pulled a muscle in my lower back, which I was told after was the diaphragm muscle, and that pain was absolutely excruciating. I dropped to the ground. I couldn't move. I was effectively paralyzed for a good few minutes. It took a long time for me to be able to get up off the ground and even attempt to stand upright. So we went to the emergency, and I asked for painkillers because the pain was excruciating. I was in I couldn't sit down properly. I was in on the ground in a doggy position, trying not to cough because the pain was just intense. And as per usual, they tried to numb the pain with tramadol. It didn't work. Tramadol just has no effect on me. Then they gave me something called Morphine X, which is like the Diet Coke of morphine. Yet again, didn't work. Then they offered to send in a pain management team to do an assessment and give me painkillers. Now, at this stage, my private health cover that I had at the Philippines had run out. It was capped. So they told me that this pain management team were going to charge a minimum of 20,000 pesos, which is probably about 500 Australian upwards. And then any treatment they gave me was on top of that. So I just saw this as a money-making exercise on their behalf. I said, no, I'll just bear the pain and go back to the apartment, which I did. But I was there from, it was like 9 p.m. to 3 a.m. It was a very, very long process. So we go back to the apartment, and not long after, and when I say not long after, I mean days after, not feeling great, watching the football. It's a Friday night, I remember that, and I'm a bit tired, so I don't watch the whole match. It's an AFL game, which is Australian football. Fall asleep. I wake up the following day and I can't see. Literally can't see, everything's black. And then it took, I don't know how long it took, but it took some time. I started to get some vision back in this eye, my left eye, but nothing out of the right eye. It was totally black. So, as you would, I panicked, trying to work out what the hell is going on here. Because at that stage, it was just a series of illness after illness after illness. We go to the emergency again, and after some tests, I don't know, I can't remember if it was established on that day or days after, but ultimately I was told that I had damage to my rear optical nerve, which caused permanent blindness in this eye, and somehow affected that eye as well. So I needed to get glasses basically because I couldn't see really. Everything was shapes and colours. So we go to this budget optometrist and got a prescription for these glasses that were pretty shit, to be honest with you. They didn't really fix anything. I couldn't see more than a few meters in front of me. Nothing was very clear. So I had glasses that I had to wear there for a period of time. So, and as I said, I can't remember specific days or dates, but not long after, it was all confirmed that the white mass on my chest was cancerous. It was metastasizing at a rapid rate. And then they made the assumption that the cancer had killed the rear optical nerve in my eye. So cancer directly affected the eye. I asked, will I get my vision back? They didn't know. High chance not, but they made me take steroid tablets, I remember, to try and loosen up the muscle to see if that worked. They also wanted to take tissue samples out of the both sides of my temple, but the advice I got from a very good friend was don't let them butcher you, so I didn't go ahead with that. Yeah, so as I said, ultimately I got the diagnosis that this white mass was cancerous, it was metastasizing. So thinking about this now, I'm in August. I'm just not gradually, I'm declining very rapidly. I can hardly walk as well. My bones are very sore. I can't sleep. There was a period just before I left the Philippines to come back to Australia where I literally couldn't sleep for 2 weeks because of the pain in my rib cage. Now, I didn't know, but the cancer had gone to the bones. So every time I tried to lay down, it was like someone trying to stick a knife into me. I'll just be honest, I was screaming, I was crying, I was in agony. I was saying to my wife, I can't go on. I can't go through this any longer. I even told her to leave the apartment, go stay with your sister, come back in 3 days, and then I'll be dead on the bed with a note. That's how bad it got. If I had the guts, I would have jumped off the balcony, but I didn't have the guts to jump from 14 stories or slit my throat. But there were times where I just couldn't cope with this pain. And then when you're sleep deprived like I was, getting 30 minutes sleep at the most at any given moment, because every time I moved, my rib would touch a pillow or touch the bed or something. It was just intense pain. So it just wasn't good. Like, I wanted to go outside to get some air. I needed my wife to hold my hand because I couldn't see. I couldn't see anything. Plus I was in so much pain. So, and as I said, my private health my private health had run out of cover. So everything was out of pocket, and look, it was so tough. Anything I had gone. My good friends were helping me, but I had to make a decision on what to do, and I didn't want to, but I left the Philippines ultimately to come back to Australia to seek medical help under the public health system here. And I'll give you a tip. If you've been out of the country, this is Australia, for more than 5 years, you've got to reapply for Medicare. Now, I didn't know that. A friend found that out for me, and I'd been in the Philippines for 4 years and 10 months. So I had 2 months up my sleeve. So I was very fortunate. But so for all you guys overseas, been out of Australia continuously for more than 5 years, you'll have to reapply for Medicare. So made the decision to come back to Australia. Now, that was difficult for many reasons. I didn't want to leave my wife. I grew to love the Philippines as well. And even getting from the Philippines to Australia, right? I get to the airport, I can't see a thing. Everything's just shapes and colours. My wife leads me to the entrance. So I go through. They won't let her through because she hasn't got a ticket. I'm on the other side and I can't make out anything. I'm looking around. I can't read anything because I can't see. I'm getting upset. I'm getting anxious. I'm asking the guards there, can you let my wife in? I can't see anything. She can help me find where I'm supposed to go. They wouldn't let her in. There were a lot of heated words said. Eventually they let her in. They put me in a wheelchair. They asked me a series of questions to see if I was able to fly. I sort of massaged the answers to make sure I was allowed to fly. And that was an extremely difficult plane ride for 8-9 hours. I took as many painkillers as I could. I had pain relief patches on me. I was just pretending that I wasn't in any form of pain. I got on the plane. the painkillers wore off halfway through the journey, so I was in absolute agony. And the guy that was sitting next to me, I didn't know who he was. Even he said towards the end of the flight, "Are you okay?" I said, I'm fine. And he said, "You're not okay. I can tell when someone's in agony." Anyway, so I get off the plane. They put me in a wheelchair. They wheel me out. I get someone to help me get my bag or suitcase. And I had someone pre-arranged to pick me up, a ex-work colleague, a good friend. I couldn't see because I was blind, basically. And he turned up, he got me, and I started crying because I was just so upset about everything, and he got upset as well. And he drove me straight to the emergency at the hospital, and the hospital system in Australia is very efficient. Plus they care as well, which is the main thing. And I got seen to very quickly. They didn't waste any time either. The couple nurses that I saw within a 10-minute span of entering emergency asked some basic questions. I gave them whatever documentation I had from my diagnosis in the Philippines. They said, "Look, we'd like to redo our own tests." I said, "That's fine." They did whatever they had to, and all their scans that they wanted to. And that was on the 1st of September, is the day I got back. And I remember later that day, so the guy that took me there was still there in the hospital, and another guy turned up, a friend, and I can't really remember if it was that day or the day after. Now you got to bear in mind, when I got back to when I got back to Sydney, I was 25 kilos plus lighter than I was 3 months ago. I was yellow, so septic. I could hardly breathe. I was choking on I was just choking basically. I couldn't breathe. I was in a really, really bad way. Some tests had been done. They'd looking over the results. There was a young doctor there called Dr. Hamish, and I just said to him, "How does it look? How much time have I got left?" That's how I put the question. And he said 1 to 3 months if you're lucky. And I just broke down crying, and my two friends were in the room. And I said, "Really?" And he said, "Yeah, unfortunately." And he looked even really sad to tell me that news. And I was in the room, I was crying, and pretty soon they took me up to the cancer ward on level 8. I got to see my now oncologist that I still have, this incredible woman called Melinda Inchins. And she said, "Don't listen to them. I'll fix you up. Just trust me, do what I say." And I'll somehow post some photos of when I first got back, and you'll see how my underwear was falling off. That's how skinny I became. I was yellow. I was gaunt. I was in a terrible, terrible way. I hadn't eaten, so they put tubes in me, but also I hadn't been to the toilet for 10 days because I was taking so many painkillers. So you can imagine how constipated I was. Anyway, I'll get into that in more detail in another video, but I just wanted to give you guys an insight of my last couple months in the Philippines and what led me to leave the Philippines to come back to Australia. And look, as I said, there were a number of illnesses that I experienced over that 2-month period, and I can't remember them all. If I do, I'll mention them again in another video, but I just wanted to get to the main points in this video. So look, thank you again for viewing. Stay tuned, there'll be another video in a couple of days, and I'll talk about my experiences of coming back to Australia and getting treatment and chemo and all of that, and everything else I've gone through. So thanks again, and see you soon. See you later. Bye.